How's my hair? Thank you everyone for being here. I know with the coordination that you're seeing daily, it's not anything other than repetitive to tell you that the effort underway to manage the outbreak, I think it's fair to say to call it an epidemic now, is comprehensive and filled with remarkable levels of cooperation, collaboration in multiple disciplines throughout the community. Of course, our Director, Administrator for Peoria Public Health, Monica Henriksen, has been the lead cog for much of the public health effort, and to that gear are connected multiple levels of command centers and practices going on in central Illinois that are all interrelated and interoperable. And it's because of the free flow of communication between those organizations and the willingness to share at a time when it's easy just to think of yourself or your own organization. To that end, I represent government as chairman of the Peoria County Board. I want to thank you on behalf of Mayor Artis and other officials in central Illinois who are not here today. This weekend, our group expanded to include Dave Zimmerman, the chairman of Tazewell County, and John Krug of Woodford County, to be in the direct day-to-day loop of coordination. The three county chairmen plus Mayor Artis are all working to coordinate the same kinds of messaging in our communities about both public resources, private resources, and certainly the public health initiative. Monica, our public health executive here, is working hand in hand with the public health executives in Tazewell and Woodford County. She and her cohorts are the best of the best, and again, my hat's off to you. We as elected officials are closely monitoring this daily, sometimes hourly, sometimes 5 times a day. I know the mayor and I were together 3 times this weekend, and again on early morning calls, and it's with this experience that we can say to you as your elected officials, our confidence in the public health effort, the medical system effort, and all of the first responders, volunteer agencies. I could really just go on and on and on until you get bored with the list of organizations connected to the effort. Has been first class. It's updated daily. There are new levels of effort that are amplified, and there are some levels of effort that are prioritized as second or third to others. We also, though, think as elected officials, and Jim asked me to speak to this, we can tell in the community that there's a little bit less traffic out there. There's a little bit less driving around and seeing people out in mass, particularly at the bars, which is really just probably not in anyone's personal health interest to continue to expose themselves to what is unknown. I remember a physician, dear friend of mine, talking to one of his attendings once about residents in their program, and he said, how do you know what the new resident doesn't know? And I've always it's Dr. Hevesy, by the way, so I've always thought about that. And when it comes to things that are microscopic, you just don't know who's got it and who's able to give it to you. And we don't want our families to become sick, or people who have other disease processes that place them at a greater risk than perhaps someone healthy, such as the elderly or people who have other comorbidities, other things going on, or who perhaps are immunosuppressed because of other medical conditions. So it's just large gatherings, medium-sized gatherings, intimate places like bars are not a good place for anyone right now. And while this is a time in our country of unusual levels of self-isolation, I think it's extremely important that we also understand that people do need contact with people, and in some cases, as folks worry about whether their job's going to be open in a week or whether they're going to be able to pay their bills, that we have mental health resources, behavioral health resources that are being expanded as we speak to be prepared for these kinds of needs. And I think some other folks may be able to talk about that today. So with that introduction, let me introduce you to the cog, the big wheel, little gear, but big wheel, Monica.
Thank you, Chairman Rand. As reported, Peoria County has a confirmed case of COVID-19. The individual is currently recovering at home and is in isolation. This brings the total Tri-County region, which includes Peoria, Tazewell, and Woodford County, to 2 confirmed cases. It also brings our total to 5 negative test results and 25 pending test results. To align with the data from the Illinois Department of Public Health, moving forward, we will be reporting as a Tri-County the number of positives, total number of tests pending, and any deaths attributed to COVID-19. Please understand that the health departments work with our hospital systems and the Illinois Department of Public Health to properly investigate and notify any individuals who have been exposed. While this process may not seem quick to some, it is imperative for our agencies to do our due diligence and work to quickly identify contacts, those exposed, and more importantly, those that have confirmed tests. In the days to come, we will be seeing increases in the number of positive cases. That is why, as a community, we need to practice social distancing and self-quarantining. Quarantine, to reiterate, are for people or groups who don't have symptoms but were exposed to the sickness. A quarantine keeps them away from others so they don't knowingly infect anyone. Isolation is someone that is infected, and again, like quarantine, is keeping themselves away from healthy people to prevent the sickness from spreading. And social distancing is involving avoiding non-essential activities as well as using caution for those activities that are needed. Examples include picking up prescriptions and groceries. It is with that the Peoria City County Health Department will be closing our building and limiting our services effective tomorrow, Tuesday, March 17th, 2020. We will be reassessing this on April 1st to determine if this closure needs to continue or to extend it for a further period of time. Much of this is because the health department is a key responsibility in the investigation and the emergency response for our community in regards to the COVID-19 event. With that, a press release was released to give clarification for all the services that we are offering and what those limitations might be. I'd like to turn it over now to Dr. Stephen Hippler, OSF Healthcare's Chief Clinical Officer.
Thank you, Monica. On behalf of OSF, I really want to thank Monica for her leadership with the Peoria County Health Department, the state, our elected officials, the other healthcare systems represented in this room, Heartland Health Clinic, University of Illinois. We're working together as a team to address this challenge we have in the community. At OSF Healthcare, we've been working on this now for over 3 weeks. When we saw what was happening in Washington State, knowing that it was coming here, we've stood up an emergency operations center, 15 incident command centers. We have multiple work streams working so that we can provide our clinicians at the front line of care with the most up-to-date information to care for patients. As Andrew mentioned, this information and these guidance and these guidelines change, sometimes a couple times per day. Our ability to procure supplies to keep everybody safe changes on a daily basis. So in addition to the work we're doing at our facility, this has also allowed us to accelerate some of the work that we've been doing at the JUMP Trading Center and Simulation Center around digital health. And we'll be introducing digital solutions for our patients so that we can continue to care for them, but care for them safely, digitally, and avoid the contact. So with that, I'd like to introduce Abby Lotz, who is our Vice President of Digital Solutions for OSF Healthcare.
Thank you, Dr. Hippler. So at OSF Healthcare, we are committed to providing digital solutions for our patients, but most of all, and most importantly, communication and access for all of the members of our community. We have stood up today a digital pandemic response center that is staffed 24/7 by healthcare professionals. So we have introduced Claire, our chatbot, on the osfhealthcare.org website earlier this week that can be used to navigate questions, general information, and initiate screening for patients. We would now like to provide our 24/7 hotline through the Digital Pandemic Response Center to all members of our community. You can reach us at 1-833-OSF-NO, K-N-O-W. So that's 1-833-OSF-NO, K-N-O-W. We also would like to provide a texting solution for all members of our community. Anyone who's interested, again, in receiving up-to-date information, asking questions, and getting resources, you can text OSF to 67634. We, again, as Dr. Hippler mentioned, are dedicated to minimizing risk and exposure for all of the members of our community. So we want to provide multiple avenues, multiple routes of communication, and access to everyone, to healthcare professionals to help guide you through this difficult time. So those members of our team will be answering the telephone, helping to guide the way for our patients and provide resources to them, either to a clinical endpoint if warranted, or provide some of that education and self-care at home around quarantine, which you heard about today. Thank you.
As a community, we understand this is a difficult time in terms of understanding the illness and the virus and the disease, but it's also a difficult time for us to understand what we are going through and what this new norm is going to be. And that's why it's imperative that we understand the mental health of our community. I'd like to introduce Ted Bender, the president of Unity Place, to talk about the impact that this is having on mental health and what solutions are available.
Thank you, Monica. As we continue to see increases in coronavirus cases in the United States, it's going to be very important that we also address our current mental health. As a country, as we see the number of cases increasing, we are also seeing a significant increase in anxiety levels. It's important during this time to remember that self-care is not only referring to your physical health, but also mental health as well. And there are things you can do during this time to increase the levels of mental health and to take care of yourself. Some of those things include doing the things you normally do. Continue to get exercise, continue to eat healthy, continue to maintain contact with family and friends, and in times of increased isolation as we are facing right now, do this through the telephone or video text or video chat. Instead of just sending that text message like we're all very accustomed to doing, make that phone call, get on video chat, talk with your family and friends to stay connected. If you find yourself having increased anxiety watching the 24-hour news cycle, consider cutting back some in order to reduce further anxiety about this. At Unity Place, which is the behavioral health and substance use disorder line of Unity Point Health, we are increasing access and increasing resources to our emergency response system, which covers the Tri-County area. You can find these numbers at our website, unityplace.org, as well as many other phone numbers and contact points and resources for mental health in the area. We are dedicated to improving and maintaining the mental health of our citizens. We are here for you. We will continue to reach out, and please go to our website for further resources. Thank you.
At this time, we will open up to questions. As usual, we have Dr. Greg Stoner from Heartland Health Services, as well as Peoria City County Health Department, and as well as Dr. Samir Seder from Unity Point Health.
Monica, we got a ton of messages via social media from people sending us notifications that they got from OSF, knowing about this confirmed case last night, wondering why, the whole public wasn't told about it until today.
This is a great question, and you have to understand that part of our process when we identify a positive case is one, that we need to contact that individual and work with them in understanding their own health, but also their exposure as well as the possible contacts. Not all contacts with a person that is a confirmed case are equal. Some people we consider a high or a medium risk, other people we consider a low risk. Based on those investigations, then we are able to start triaging based on high risk down to low risk with our community health partners, other health departments, because they may reside in different counties, to start the process to get those individuals aware of the situation, ask them to start self-isolating, monitoring their symptoms, as well as to notify their healthcare provider if additional testing is needed. This is a lengthy process. Again, if you think about your own lives and considering if we asked you in the past 3 days, can you enumerate the individuals that you might have been in contact with is a large investigation. And so with that, we ask the public to be patient with the health departments. We will continue to notify along with the governor's notification, and that's because we are doing our best, hence why we are closing to put those resources for contact tracing so that we can really get those people that are at the high and medium risk identified early and start that process. But we appreciate our healthcare providers because they work with us, provide us information, and that we can have a really comprehensive and direct approach.
Did the Woodford County patient work in the medical field, and has that person been traveling overseas?
I can't speak to those details. They're identifiable for that patient, but we are investigating that individual's entire history in the past few weeks, whether it's travel-related or the other interactions that they might have had.
For this Peoria County case, what can you confirm about them being tested at home, and is that even an option? There's a lot going around.
I will confirm that they are a Peoria County resident, but in terms of testing, our healthcare providers are providing various options for the community. Some have clinics that they are utilizing, others are sending in home health to do the testing. In some communities, not here locally, but in other areas, they are doing drive-through testing. Those are all options to really talk about social distancing, and again, not putting high-risk individuals directly into the emergency departments. And so those are all a variety of testing points that are used.
How old was the most recent patient?
We are no longer sharing information based on gender and age range anymore. And that's aligning with the Illinois Department of Public Health's guidance to local health departments.
Was the patient treated in Peoria around a large group of people prior to the positive test?
I can't answer that question.
Do we believe at this point that the cases are being transmitted mainly by travel, or is there believed to be community spread happening at this point?
Right now, with the case level being at 2 positive tests for our Tri-County region, we feel a lot of this is still coming very slowly, thinking that there are more so some travel history based. Having said that, once cases are in our community and through that investigation process, understanding all the individuals that they have been in contact with during the times they've been symptomatic, then we recognize the fact that community transmission is really the next level that we're going to be going towards.
Can we talk about elections for a minute? I'm getting a lot of questions today about keeping the elections safe, and I don't know who the appropriate person is for that question, but I mean, I know there's going to be hand sanitizer and other things around. Is that enough at this point? Should people still feel comfortable going to vote at this point?
The Election Commission has been working on this for a long period of time, recognizing things such as closing polling places that were at high-risk populations, as well as trying to maintain as many supplies as possible, starting more stringent cleaning guidelines for their polling places. In addition, they're even asking their electoral judges who might be high risk to actually not necessarily participate this time. So the Election Commission has been working on this plan for a while now, and I would direct those to Thomas Bride, part of the Election Commission.
Clarification question, did you say 5 negative tests, 15 pending tests? Can you repeat that?
Yes, in the Tri-County, which includes the Peoria, Tazewell, and Woodford regions, we have 2 confirmed positives, 5 confirmed negatives, and 25 currently pending tests.
What would your plea be to the community, over the weekend, obviously being shocked for people, the governor's announcement of closing dining in and restaurants, have some owners even openly saying on Facebook, I'm going to be open anyway. I guess what would your plea be to those people and explain to them why this is a necessary step?
When we're talking about a virus that is novel and that we don't have a vaccine or medication for it, our best way to really combat this is going to be using non-pharmaceutical interventions. And one of the strongest tools that we have in that is quarantine, isolation, and social distancing. We understand that it is difficult for our public and for our small business. And in fact, you can actually visit the Greater Peoria Economic Development Council. They are linking small businesses with opportunities to help assist them during this time. But overall, practice that social distancing, self-isolation, and quarantine, because we have high-risk individuals, and we really do want to make sure that we maintain the capacity of our fantastic healthcare system here, that we take care of those high-risk populations, and that we don't unnecessarily spread this or cause undue burden in our community.
Are license revocations a possibility if there are any restaurant or bar owners out there who do not obey this?
I think really our biggest focus right now is educating them and understanding what their needs are. I think When the declaration was made, there is some concerns about interpretation of it, and we are all working with the Illinois Department of Public Health to make sure that we are able to assist with that. Are there any questions for the other speakers?
Yeah, I would like to talk to the person on mental health, whoever that was.
Ted Bender.
Hi.
Hi.
There's a lot of people that are very tight. You know, you're seeing a lot of jokes that these zombie, hordes coming without the actual zombies out there. You mentioned that there are some services out there, and you mentioned numbers, and you mentioned to do FaceTime or phone calls, but what are some of the services, what are some of the stresses that you could do? Because you said people should go on as normal, yet there is no normal anymore. There is no place to go. There is no place to go out. Could a parent bring their child over for a play date? I don't think so, based upon what they're saying. So there's no avenue here to be, quote, normal. What would you say to that?
Well, I would first say, luckily I haven't seen any zombies yet, so we're not at that stage.
You sure?
I'm so far, yes. But what I would suggest is, a lot of people, especially people who are suffering from mental health disorders right now, and I think what you're getting at, is that a lot of their fears seem to be coming true, especially people with anxiety disorders or obsessive compulsive disorder. And what we're seeing and what a lot of people are experiencing is an increase in symptoms like hand washing, germophobia, things like that, avoidance. I think the best guidance that we can offer in times like these is to really follow the World Health Organization and CDC guidelines for hand washing, for example. And if you're unsure about what to do, about how to keep yourself safe in this situation, talk to a trusted friend, a therapist, a family member, see how they're handling this, and consider molding behaviors based on that. Now, we are in a situation where large groups or gatherings is not a good idea, and as mentioned, social distancing is one of our best tools. But individual therapy is still continuing, telehealth therapy is still continuing, access to your therapist is still available, and when we're suffering from these types of crises, it's important now more than ever to stay in touch with them and to continue following guidelines even during this crisis.
Can we talk a little bit about exercise? I mean, is it recommended to go to the gym at this point, or should you seek out alternative ways to exercise that are a little more solitary?
That's a good question. I don't know if I can answer to the whether or not it's safe to go to the gym question, but what I can say about exercising is it is one of the best medicine, one of the best weapons against mental health disorders, and there's quite a bit you can do right in your own home. Push-ups, sit-ups, squats. If you Google online home exercise, you'll find thousands and thousands of videos, and that's a great point. I would definitely increase exercise and self-care during this trying time.
Is there someone here who could talk about gyms and working out there? I mean, Monica, is it a safe thing to go work out at the gym because folks want to do weights and whatever?
So I think you can recognize the fact that some of our large gym facilities, such as our park district, have closed down their facilities because they recognize that they were gatherings for large individuals. So with that, social distancing, is that an essential service for you to go to a gym? Not necessarily. So we were requesting people to avoid those spaces with large gatherings or those activities. But as the president of Unity Place mentioned, Mr. Bender, that you can still exercise in your own home. You're able to still go on walks, socially distancing yourself in those areas, but just take precautions and recognize the fact that your exposure, as well as possibly exposing others, is what really is going to help us through this event.
What is your suggestion on daycares? I know we've gotten a lot of questions about that, because, obviously K through 12 shut down, but what about, those people that aren't in school yet?
I think the interesting part to recognize about daycares, especially here in southern or central Illinois, is that our healthcare providers are the largest employers in our areas, and daycares are imperative to make sure that they are available to come and take care of us during this event. I know the governor understands that. Representative Jahan Gordon Booth has made sure that is a priority in discussions with them. But as this continues, you might see changes in terms of how daycare process. Daycares are regulated. They do have standard infection control plans. But again, we're still looking at how this is going to progress as the days go on.
I know you all continue to emphasize social distancing. What advice or what do you have to say for people who work in a workplace where you're consistently next to someone, close to
This is a great question, and when it comes to looking at how to use social distance in employment areas, really you're going to look at your employers for reference guides, understanding that if you are feeling sick, you should not come into work, as well as understanding your symptomology as this progresses. In addition, good hand hygiene is going to be important in those circumstances. Now, if employers are looking for information in terms of how they can work with their employees or what practices, the CDC has a great resource guide, but again, the Greater Peoria Economic Development Council, the Peoria Chamber, and the CEO Council all has great resources for businesses here locally to get that toolkit.
For self-quarantining and stuff, you're going into grocery stores and shelves are still empty. What are some recommendations for people who do have to quarantine for a while and their food sources going out shopping might be a little limited?
That's understandable. You know, if you have individuals that can assist you and provide and go and do grocery shopping for you or deliver it as well, you know, keeping that social distancing, maybe leave it at the front door and come back. Those are all different options for it. But definitely talk to your healthcare provider if anything comes into a need as well, because they can address that or help you find resources. A great resource here is 211. 211 is a great point so that if you have questions about how do I find groceries or food delivery, or even understanding kind of those needs of helping for those type of services, 211 will direct you there.
One of the things I'd like to know is, has the health department or has anybody here heard about price gouging? You know, we've all heard the horror stories online about toilet paper costing $40 or whatever it is. Is the health department have you guys heard anything about that? And has your operations group heard about that? And if so, are you guys going to take any action on that?
Not necessarily the health department as an agency has addressing it, but our entire emergency operations center, which is looking at donation management and resource allocation, is looking at how do we get supplies to the right places. So resource allocation is making sure that our first responders and those that need those masks and protective gear are accessing it through various statewide and national entities. And then I believe on last Friday, Representative Ryan Spain mentioned that there is a donation center for people that do have different items that we would like to share. It can be vetted through that as well.
Are homeless shelters and stuff still going to remain open?
Our shelters in our area are remaining open. They are, again, watching and have gotten guidance from from the CDC as well as HUD to understand their own infection control plans and what they can do. Some shelters might be looking at changing how they do operations, but again, we're understanding that everything kind of is different every single day.
Elections are still going on, and I understand they'll have hand sanitizer and things to sanitize your hands with. But do you think it's a good idea, although, you know, we're saying you shouldn't go into large gatherings, it shouldn't be more than this amount of people there, do you think it's a good idea for people to still come out?
I think the Election Commission has been addressing this for a while now with educating people on the ability to vote early as well as mail-in voting. And then again, the processes that they put in place, especially for those of high-risk populations. So I think the Election Commission has been really in the forefront here locally to make sure that education has been supported as well as doing what they can on Election Day. Again, if you do have further questions in regards to election, I would direct it to Mr. Bride of the Election Commission. Well, thank you again. If you have any further questions, our Joint Information Officers will be communicating that. As a reminder, because we understand the issues with the Wi-Fi here, we will be moving tomorrow's briefing upstairs.